Hello, everybody. Welcome to Ask an Expert. It's me, Jessa. If you're listening, it's Jessa. If you're watching, you can see that it's Jessa. And I'm here with Dr. Casinella today. You might recognize that name because Dr. Casinella was one of our very first guests on Ask an Expert when it was called Office Hours. It was probably 2 years ago. And at the time, right when we got done with the conversation, we asked her if she'd be willing to come back at some point because it was just like chock full of learning and information that we all need to know. And she has graciously agreed to be here with us again. So Lisa, thank you so much for doing this with us again.
You are very welcome. It's my pleasure. Enjoyed it the last time. I was a little nervous because I had never done one of these things. So I enjoyed it, and there was great questions, and it was good conversation. And I'm very fortunate to be a part of this. And I hope everybody had a good Thanksgiving holiday and are getting ready for winter, obviously, depending on where you are. I'm in Ocala, Florida. I've been here for 13 years. So I do know a little bit about winter because I did practice for 13 years in Charlottesville, Virginia, and grew up in Syracuse, New York. So I do know about winter, but I'm pretty Florida-fied at this point in my life. So I did have all my outfit on today, and I think it was 65 degrees, but I looked like it was probably 35. So I've become a little bit soft, but I enjoy the cold weather. And but I'm lucky it doesn't get too cold here for too long.
Right. Well, it happens no matter where you are in the country or the world, really. If the weather's changing, you're bound to start bundling up just based on the context of where you are. I know some people are in much colder locations right now. I'm in Colorado, which has been getting pretty cold. We've been in the 20s, but we have questions from some people in Montana and Maine and Minnesota. So definitely people from cold climates. And I was laughing today because I realized I kind of designated that part of the topic today, in addition to Ask Me Anything, so anything goes. In addition to Ask Me Anything, part of the topic is winter care tips. And then it occurred to me that you're in Florida. So I was happy when we got on before this and you said that you spent a lot of time in cold climates. And I'm sure you would have been able to field these questions either way, but that was kind of ironic to realize that you're not really in like the tundra and haven't been for a while. But maybe before we get started, will you tell us a bit more about your career as a vet, how you got to where you are, really anything that you want to share about your journey to, landing in the practice that you're in now and the horses and clients that you're treating now, for anyone who didn't get kind of the spiel on that initial episode or needs a refresher.
Well, I am a lifelong horse person. I'm pretty myopic. I haven't really done a lot of other stuff in my life other than horses. I grew up in central New York. I rode lots of different types of horses. I thought I was going to be a groom, and really sometimes I just want to be a groom. And I just enjoy working with grooms, and I enjoy just being in a barn, and that's kind of my first love. So I had a really varied experience growing up in that area and working with lots of different types of horses, which is something I really enjoy about my job now, because every place I've worked, whether it was in Charlottesville, Virginia for 13 years, I did a brief stint in Richmond, Virginia, and been in here in Ocala, Florida, lucky enough to work for BW Furlong and Associates. Dr. Brendan Furlong is our fearless leader. And I used to work with Christiana Ober. We were kind of a duo down here until she moved to the UK and is the New Zealand eventing team vet, which a lot of you people have probably met her through being in Florida or being in Virginia. I get to work with great people. Dr. Shane Harley and Dr. Jill Copenhagen and Dr. Johnny Furlong are part of our practice here in Florida during the winter months. And Dr. Shane Harley is with me year round, which is awesome. And everybody else goes up north for the summer months because they get to go and be in not humid tropical weather. So they get a little bit of a break. And Shane and I suffer down here. I have an Irishman who has learned how to be in the tropics, and he got a little bit of a tan for the last 2 summers, and he's awesome. If anybody comes down here and is part of our clientele get to meet him. He's great along with the others. So I've had a varied career with working with lots of different breeds. I'm a fan of saddlebreds and Morgans and Arabians, and I'm proud of that. And also did a lot of just kind of random horses up in Virginia. Good, just, nice pleasure type horses, but was also very lucky to work with a lot of high-end racehorses and event horses and hunters and jumpers and some dressage horses. And that followed me down here to Ocala when I moved here, and very much involved with the eventing community, which has been amazing there. It's a great group of people to work with, very dedicated. I think they do the hardest. I think eventers do the hardest discipline that can be done. It's very demanding on your time and your nerves, and it takes a lot for these horses to get to be able to do 3 phases of something that is just hard to get one horse to do one phase. I mean, I think, like I said, I think the eventers are the toughest breed. And I get to work with a lot of jumpers, some hunters, some dressage horses. I have some Arabians and saddlebreds here. And I also am involved with yearling to 2-year-old thoroughbreds. My husband is very much involved with the industry. We have a nice partnership with another gentleman, and we have a training barn with about 80 to 90 horses. Some we own, a lot are clients, and they're all yearlings, and they come in for kindergarten and they learn how to become a racehorse, and then they generally hopefully exit as in the spring of their 2-year-old year or summer. We are very involved in the 2-year-old thoroughbred training sales here in Ocala. There's 3 great ones here. And so I have my hand in a little bit of everything, which I really enjoy. It's nice to work with different types of people in the industry, coming from all different angles. And I enjoy it. And I have just some pleasure people here too that live in my neighborhood and have pleasure horses. And I just, I'm very lucky to have a good variety of horses and people. That's what keeps me kind of interested and engaged.
Yeah, I bet. That is really cool. You said you have your hand in a lot of things. You also have your hands full. When you reminded me about the training program, I was like, that is, a lot of horses under your care. But I know that you have a great team. Oops.
Yes, I am blessed. I have a super team of veterinarians and technicians that are in Ocala with us, and we're very lucky. I have an awesome tech, Faye Lambert. She's amazing. Megan Strayer is part of our group, as well as Kate Russell and Jan Hamilton. So we can't do our jobs without those ladies, and it's a good group. We enjoy it, and I miss half of them when they go back up north because they leave Shane and I, but it's nice when we are all down here for 5 months of the year together.
Yeah, I bet. That's really cool. And it's such a gift to be somewhere like the geography you're in for you, because you can have a community of, colleagues and clients that are wonderful, but also for the horse owners to have veterinarians, close and available, and great high quality veterinarians. One thing that we were talking about before we got on, when it comes to winter, is some people who are in northern locations, or especially more remote locations, might not have close access to a veterinarian, whether that's because of a snowstorm or just because they don't have proximity to a vet. So can we start by talking about being prepared for maybe like your emergency kit, to be prepared in case something were to happen and the veterinarian can't get to you for a significant period of time?
So that's a great, this should be regardless of the weather, right? But I think it's a little bit more incumbent when you're thinking about winter and or traveling, right? If you're, and a lot of people have their show, trailers have their little emergency kits and such, but I think it's good to think about it for the weather. And again, I'm in Florida. There's a gajillion veterinarians in Marion County, right? We don't have too many weather issues unless it's a hurricane. But for all of you people elsewhere, that your vets are more remote and they're more stressed because there's less vets in some of the more remote areas that you may live in, and there's weather concerns, like there's snowstorms and ice storms, and the things that you're probably used to calling about, sometimes you're not going to be able to get seen that day or that night. And I think it's really good to be able to talk to your vet. Telemedicine, which is stuff that we all have done for 100 years, that now it's called telemedicine, is helpful. I'm sure you guys send pictures of things to your vets. Like I get all of my clients all the time. And I think that's certainly helpful. And we can help triage things when your vet can't get there for whatever reason, whether they're just too overfaced or the weather is bad, or, whatever the situation is. So I think it's good to be able to have some basic stuff, right? So I think to have bandage material, right? So if you have a wound, not every wound needs to be sutured. Like lots of wounds heal over time because the vet can't get there, or they're not found for a few days, or whatever the deal is. But I think it's really important to have it doesn't have to be complicated, some good bandage material that is, and the ability to have, to clean a laceration, right? Some chlorhexidine or betadine, something that is, useful. You should have that on hand. So bandage material, wound care. I think it's important to have some anti-inflammatories. Now, not everybody can give an IV shot, and that's okay. But there's some certain things that you can use orally. Certainly you can use bute orally with direction from your veterinarian. You can actually use injectable Banamine orally if you have injectable and you're not comfortable giving a shot in the vein. And we never promote using Banamine in the muscle. I know it's on that label that you can use it intramuscularly. You don't ever want to do that in a pinch because it can cause some myositis infection issues. So, if you can't do it IV, you can do it orally. So I think those are two good anti-inflammatories to have on board. I think it's important to have the ability to potentially, if you feel comfortable, having a tranquilizer if you need it. And again, I'm cautious about that. I certainly have dispensed tranquilizers to clients with their understanding of how it's to be used. Usually it's an intramuscular shot. Obviously there's some concerns in the world with xylazine. I'm sure everybody's heard that is a drug that people are abusing. So I'm very cautious about how we dispense that, and we have to have a good relationship with somebody and that they are comfortable potentially using that drug. And I don't give it out willy-nilly, but I think it can be very certainly helpful even on a colic situation where, if you don't have a vet and nobody can get to you because the vet's 200 miles away and there's a snowstorm, sometimes giving some Banamine and orally, which isn't the best way to do it, but a tranquilizer in the muscle like xylazine or a little bit of dermosidan can really make a difference in the horse that's not going to have a surgical or a medical issue, if that makes sense. Because sometimes if it's just a little gassy and we can get through it with, again, you're discussing these things with your veterinarian. You're not, doing this willy-nilly on your own. But sometimes it's not the best thing, but it's the only thing that we can do in an emergency when, there's an issue with weather. So that's something to have in your emergency kit with definite mentoring from your veterinarian. And if you're not comfortable with it or it's not appropriate for where you are, then, you have to make do with other things. And we understand that. Eye medication is really helpful. If you have a horse with a swollen eye and it's 10 o'clock at night, and it's a snowstorm, you can feel comfortable putting some Neopoly back in there, even if it's got an ulcer, and giving the horse some oral, anti-inflammatories until maybe the vet can get there in the morning. If you can have a pen light so that you can look at the horse in the dark and ascertain that there's not a piece of wood sticking out of the cornea, which would be a little different, or, hey, there's a little scratch in there, I can kind of triage this until somebody can see me the next day. And again, this is all to be kind of, again, a telemedicine type of a scenario, because I don't expect people just to be their own vets. Now, there's a lot of you that are and do a good job, but for these purposes, I think it's just smart to have a quick phone call or a text to your vet when you're in that kind of a situation where you need some guidance.
Totally. Yeah, that makes complete sense. I mean, then when you're on the phone with your vet, you can kind of have a sigh of relief. if you have those things on hand that
Yes.
I'm sure they're asking for
Yeah.
to kind of bridge the gap between when someone can be out there.
Sometimes some oral antibiotics. I mean, I think, again, I'm really cautious about, I don't like just throw the Bactrim or the SMZs or the trimethoprim sulfa, however you want to call it. Those are probably the most frequent drugs that people have on their shelves in case that there is a wound. That's a great product. When there is a wound, we kind of use that. So it's, we're comfortable with, again, with mentoring and a good patient client relationship to be able to say, okay, you've got a bottle of SMZs. I know how big your horse is. This is appropriate. You have a wound. You've cleaned it. You've got a good bandage. Yes, let's get it on some antibiotics. And I think we feel comfortable, and everybody understands the risks, but it's really nice when somebody has those things, so that, we can do the best that we can do for these horses, even if we can't be there. But, a picture, a video, all those things can be very helpful to help you guys with these things. I think to have some shoe equipment, right? Like you should have some crease nail pullers, because it's very easy to get a shoe off if you have crease nail pullers versus just pullers, right? And some nippers if you have a horse that's torn part of its hoof off in the ice or something, and at least you can cut that off with something that is useful versus trying to saw it off, which I've had people do because they didn't have hoof equipment. Everybody, on this webcast should have hoof equipment, just some basic stuff. You don't have to have what I have, but just enough that you could pull a shoe off appropriately and nip out some an avulsed piece of hoof wall, and then get it in a bandage and wait till the vet gets there. Boots, they make really nice boots to ride in. As far as horse hoof boots, I think there's soft rides, there's cloud boots, and there's lots of different stuff on the market. You guys probably know more of that than I do, as far as if you have a horse that you may have a foot abscess, because that's probably the most common thing, like emergency. We see the non-weight bearing horse that, at least you can put a foot pack on, and if you have to pull the shoe, and you can put a nice boot on and at least cover the foot until somebody can get there. So that's another nice thing to have for an emergency. Those are probably I would say, the biggies that I can kind of think of that you'd have regardless of the weather. I think you have to plan ahead to, if weather's coming in, to not do anything crazy different with your horse. Like, let's not vaccinate it the day that, you're supposed to have a blizzard, because that horse will definitely have some sort of a colic episode thereafter, or a fever. So you could plan on that happening. Deworming. Like, I try not to, I think, like when I used to be up north, when we'd have those big weather changes, we try to not encourage that kind of behavior with the clients and horses. If we knew there was something big coming, like, let's not do any huge management changes, right? As far as, veterinary intervention, and elective things that we can do at a different time. I think that's important, to not rock the boat, because we all get worried when they have to come in and they're used to going out all night, and are they going to have a colic episode and all those things. So you don't need to compound it with doing a bunch of stuff that you didn't really need to do, knowing that there is, weather coming in, or you're going to have extreme temps. I think those are smart things to just kind of think about, not rocking the boat.
Yeah, those are such great tips. I honestly it wouldn't have occurred to me to consider, if there's a big weather event happening, that I should change a schedule on something like a vaccination or deworming or something like that. But it makes perfect sense. Everything that you've said so far is gold. I hope people have their notebooks out, because this is the type of information that's perfect going into winter. As far as specific questions that we got from members leading up to this conversation, they kind of fall into 3 categories: blanketing, shelter, and winter weight. Maybe we could start with blanketing.
Okay.
Samantha said, and some of these will be kind of similar, but I'll ask all of them just so people can have their specific question addressed. Samantha said, I have a 29-year-old gelding. He's turned out 24/7 with free choice hay, and he gets blankets appropriate for the weather. At what point is it worth pulling him out of the field away from his herd mates, adding stress to keep him protected from the weather? Last year, we had temperatures so low that big businesses were losing their water lines, not just poorly insulated homes, which is not that typical for this area.
So that's a great question. And thank God I don't have to worry about that here because that's really cold. So I think like I am so air on the, like the older I am and the longer I've been a vet, I try not to rock the boat with the older horses. So, I mean, unless it's like rain, ice, like wet, miserable, those kinds of conditions, I try to leave the horses out. And I would say, I would think that my colleagues up north would say the same. If it's like cold is cold, if it's wet, if it's ridiculous and you know they've got to be really rugged with the whole 9 yards with an old horse. I mean, if they have good flesh and a good coat, that's great. But obviously, you know, I'm sure you have a light, a medium, a heavyweight, a super duper waterproof. I'm sure you have all those things, but I really try to not rock the boat unless it's like that would be my advice to you if I was up in the Arctic and you called me and said it's going to be not windy, but it's going to be 10 degrees below zero. If it's the old horse, I would make sure that their water isn't going to freeze, that they have access to lots of hay. I think nutrition's the other big important thing. I think that hay is so crucial, right? Like the hay is what keeps these horses warm, so more so than the concentrates that they're getting. And most horses probably are, I see way more horses that are fat than thin. So at the end of the day, I think the hay is probably the most important thing, that they are able to be munching on that through the night and have the ability to have a fresh water supply and preferably warm. Horses tend to, if they're given the opportunity to drink warmer water than cold, they'll drink more warmer water. I wouldn't put electrolytes in there or do something different to the water so it tastes different, because that can cause, especially an old horse, to be like, I'm not having any of that. And I wouldn't change their diet. Like some people do these mashes of different types of feed, which is something that people did I think some people still do that. I'm not a big fan of that, because I don't think you should be changing the concentrate, because that can change pH, and that can cause an imbalance in these horses to have GI issues, to all of a sudden decide, well, it's going to be cold, I'm going to give them a bran mash. Well, when they're not used to eating bran, that's not a really great thing to all of a sudden add in. What you can do is you can make their concentrate a little bit, of a warm slurry if they're happy to eat a warm slurry versus, I mean, some horses don't like to eat it wet, right? There's also horses that you think you're doing a good job and you make a nice warm dinner for them and they just don't, they want it dry. So I think that you have to know your horse, especially the old horses they're tricky, and I try not to change things up. So I think that you have to use good judgment. And if you don't have extremes in horrible wind and rain and ice, then I would probably err on the side of caution and make sure the horse is rugged up and happy and not change his environment, and make sure he's got the basics overnight, and, like that he's got a ton of hay, or if he's getting a hay, like if he's got it on a round bale or something that is safe and that he can get into. And with his friends, I think those horses just do better at the end of the day versus, the drama of they come in, even though their friends are in, they're not used to it. And you, like I said, maybe some old horses are good, but I know plenty of old ones that are just like, get me out of the barn. I do not want to be in here. And, we just bring them in when it's just extreme, and then you take your chance.
That's really helpful advice. That's the sort of advice that is nice, because on those super cold days, now she can just be like, I know what my approach to this is, versus should I put them in? Should I leave them out? So that's great. And now I'm going to start bouncing around questions, because some of these will relate to one another. And I think this question from Steph relates a little bit to what you were just chatting about. So Steph said her horse is out 24/7 in the pasture. Now that the grass is gone, do you have a list, or maybe just one must have, of a vitamin or mineral or supplement that she should be adding to his diet until the spring grass returns?
Depends on where you are. Like everybody's pasture is different, right? Like a lot of the pastures down here are not great in Ocala. Some of them are. Like I have some clients that would probably be horrified if they heard me say that, but it's way different than Virginia, let me tell you. But you're right. Like the quality of the pasture does change, and you can get extremes with the content of the sugars in the grasses we kind of know about, as far as when you're trying to deal with metabolic type horses, you get you get, a change in the temperature and frost, and you can have changes in the sugar content. And some horses are really sensitive to that. When the grass is just dead, wherever you are, or you have snow cover, like you got to make sure you understand your hay source. A lot of people don't test their hay. It's actually pretty easy to do. And a lot of the vets have cores that you can core out a piece of hay, and again, or of your hay bale. And sometimes it depends on where you get your hay and all of those things, which you should know about. Like if hay may come from areas where there's like a selenium deficiency, and we know vitamin E and selenium are good for horses' neurologic health, skin, hooves, things like that. It's cardiac. I mean, those are important vitamins that can be added. And I think we look at those all year. You can test for vitamin E and selenium, but if you know your soil is deficient, like up in the Northeast, or your hay comes from up there, then that can be a problem versus hay that comes from out West and in places where you know that it's likely going to be okay. I think that I'm not a big, huge supplement person, honestly, because if you're getting a good quality hay and you're feeding enough of it and supplementing it with concentrate, which you're buying from a reliable feed company, which I'm sure most of you are, you're not making your own corn and oats and screwing up the vitamin and mineral balances, which, I mean, there are some people that do that, and you have to be very cautious with that. But I think that, your hay is your kind of standard of the diet for a horse that's probably not metabolically or not calorically challenged, like a racing thoroughbred or, a high-end event horse. A lot of these horses that are not like, they're fat, right? Most horses I see are going to be more overweight than underweight. The hay is the most really, that's kind of your cornerstone of your feed plan. And then you can add and subtract your concentrate based on your horse's metabolic needs, caloric needs, and where you are in the country. So I can't say I would, like if you lived in the Northeast, I think most people are kind of sorted on vitamin E and selenium. You can test for that. You can add those
in Illinois, if I recall correctly.
Depends on, I think that's probably not an issue in that area of the country, but I think you have to supplement hay. I do see horses that don't get enough hay in the winters, even sometimes down here, especially the thoroughbreds, like you've got to push the hay, where maybe their paddocks are big and nice and, they're pretty good in the summer, and they look good. And again, you have to look at the horse, right? Like if you see your horse losing condition, obviously you've got to supplement it, add as much hay as you can a few times a day. And then the concentrate is what it's easy to do concentrate, but it's not the best thing for the horse. I think hay is underrated for, most of these horses that don't have weight issues, if that makes sense.
Definitely. Yeah. It's so fun. The people who ask questions are here live, which doesn't always happen, but Steph said that she's in Northwest Illinois. So, yeah, you are responding to that appropriately. And you are, for anybody who hasn't listened to a lot of Ask an Expert episodes, several experts have recommended, nutritionists or veterinarians have recommended testing your hay. And it seems like it's kind of an underrated thing.
Nobody does it. But it's so easy to do. And if you are getting a shipment of hay from, somewhere, right? So the hay, hay isn't always homogeneous, right? it's coming off of pastures, of fields, et cetera. But generally you got to start somewhere. So at least if you understand the content of the hay, and if you're trying to really sort out a horse's diet, then you can make some good decisions, especially if you're working with one of these feed companies. And the feed companies, they do it for free because they want your business, and they're really good. So that's a really nice thing. If you say, hey, I've had my hay tested, I just got hay, this will last me for 6 months for these horses, and here's what they do. You can have a really nice meeting with, and that it is not me, because nutrition is not like, that is not my department, but I know enough, and I know to send the people to, the reputable feed companies that I work with, and they can balance the diet so that the horses are getting the least amount of concentrate, and you're not using a gajillion supplements, because a lot of times you really don't need to do it. Everybody wants to do such a good job, and they're just like, what can I, my horse has crappy feet, which supplement should I use? I tend to stay with a lot of the bigger companies that have some research behind them. If you're just going to if I am going to push somebody in that direction. I don't have any ownership in Platinum Performance, but I think their products are really good. And they're tried and true, and they put a lot of research and a lot of money into their development. And I think they have a great line of stuff. There's other good lines out there as well. I don't mean to pick on that. And I hope I didn't get in trouble for saying that company, but
no, honestly, specific recommendations are great. Like,
yeah, I think that's one of the,
no need to be big.
I think it's a reputable company, but I think you can, if you really want to, if you're that person in Northern Illinois and you've got a bunch of horses and you want to take a little extra time, it's I'm sure there's a vet in your area that has a core sampler, and they just drill a hole into it and you send it off to be analyzed. And then you can work with whoever you work with, Triple Crown, Purina, Buckeye, all of these companies can say, this is what you got. They put it into a software program and it spits out, hey, for this group of horses that are this weight and doing this kind of work over the winter, here's their ideal diet. And actually using, the great intelligence of the nutrition, like nutrition has gone exponentially 100 million miles forward than it was when I graduated vet school in 1996. So there's a lot of easy ways to get information without spending a whole lot of money doing it, and making better choices for your budget and your horses. Because I see lots of people that feed so much extraneous stuff that if they do listen to me, they're like, oh my God, like you just cut my feed bill and my horses look great. And, everybody's happy.
Yeah, that's such a great resource and like support system that people can tap into. Somebody just said that they Googled reliable hay testing sources, but it sounds like going to those major feed companies are really, going to your vet to get the sample, and then the major feed companies often
they're going to help you. Yep. They're going to help you or they're going to say, hey, where can I send this? Or can I work with you? And yes, will they do it for one horse? Yes. But if you have a barn full of horses and you're using, Purina, they're going to help you, and they have the software program, and the hay is kind of it's great to have that information, right? Because that's probably the hardest variable that the person is going to be able to change, right? Like there's 1,000 different types of concentrate, and half these horses just need a ration balancer. They don't really need calories. It's a high protein, and it's got a mineral and vitamin kind of balance for the basic horse that doesn't need the calories. It's a high protein, and that's what we kind of feed a lot of these metabolically challenged horses, so they can get the least amount of calories from a concentrate, but meet their vitamin and mineral needs, which is important to have a mineral block. I think that's a nice thing for horses to have, but a lot of times you can get away with, less is better. You can't skimp around the hay on some of these horses that are hard keepers. The fat horses, it's a little different. You don't have to be so. I think you can have a little bit more leeway with the hay. You certainly want quality hay. You don't want cow hay. You don't want moldy hay. You've got to have some nutrition, but you can make some choices whether you're going to have a grass mix or you're going to add some alfalfa in there, or if it's going to be timothy, and what you have in your area. Like we don't always have all those choices. So sometimes you have to work with what you have, and hopefully, like I said, there's great. People should seek out their feed companies for advice regarding just a better and a more proper way to feed. Weighing your feed, your concentrate, like weighing the hay, things that a lot of people don't do is a pretty useful tool to really feed horses the right way. If you're feeding a very metabolically challenged horse, or if you're feeding a very thin horse, or if you're feeding a horse that's been, recovering from an illness, those can be really helpful, and the feed companies are great.
Yeah, that's if anybody's having trouble finding the resources they need, take this conversation to the Facebook group, and we can all kind of help out so that you get that support that you're looking for. Because it sounds very worthwhile to go through that exercise with some experts helping you. Okay, next question is from Hannah. Hannah and her horse Dara are in Montana, but I'm not sure if this is about Dara. So Hannah said, is there any harm in blanketing, like a medium weight blanket, a horse that has a coat like a yak in extreme conditions to help him not have to eat so much hay to keep warm? She said extreme conditions here are temps that are negative 15 degrees Fahrenheit or colder, with wind chills that could go all the way down to negative 50, and typically snow. She said the horses outside has access to shelter and free choice grass hay, plus some alfalfa during these conditions. She said, but the normal overnight lows are just single digits above zero.
Okay, and your question was if you blanketed them more with the biggest question would be like, what is the condition of the horse? It's great that he's got, hair like a yak. That's helpful because that's going to have more insulation factor. But, is this a horse that's like hog fat? Is this a little quarter horse that's really muscled and happy and, like has a body condition score of 5 or 6? Or is this, the 29-year-old horse that if you took the blanket off, people were going to be a little bit worried that, which again, like old horses can be thin, and I'm okay with that because they're better off being thin than fat for a lot of reasons. But that's an important factor in this, because if they have good conditioning and good muscling and such, then I still think that again, adjusting your blanket for depending on if there's high wind, again, if it's rainy, if it's icy, and they're happy to go in the shelter and they're smart and they're not going to just be iced over when you see them at 6 o'clock in the morning, then, I'm always happy keeping them out. But I wouldn't skimp on the hay. I still think it's really important to have hay going through these horses because that's, they're not able to eat grass because there's probably no grass where you are at that time of the year, and this ground is covered in snow. So it's going to be up to what you feed them. And I think that we all know horses in a perfect world should be able to be grazing, consistently and constantly, right? They're grazers and they're supposed to be eating most of the day. Now they're not supposed to be eating grass that's like this high in Virginia and they're metabolically challenged and it's like spring, right? Like those horses, we know those are a problem, but like you got to make up for it when you're in the middle of a cold winter. I think hay is always important for them to have GI wise. Yes, it's important for them to stay warm, and you got to go out there and feel like if your medium weight is, if they're cold and shaking, they need another blanket, right? If they're sweating under it, then that's a little different, right? And you have to be a little cognizant of that. But I would say I wouldn't skimp on the hay, honestly.
Yeah. We have 2 questions that are kind of similar and might be redundant, but I definitely want to address them just in case you have things to add. These are from Emma and Sarah, and the gist of both of them is their horses are dropping weight in the winter and they're not really sure how to address that. So I'll read through these so I can get a little more specific. But Emma said, what are the best methods for keeping weight on a 14-year-old thoroughbred mare? She's on full stall board and gets plenty of hay while stalled and turned out. She holds weight really well in the spring and summer, but drops in January and February. I haven't found the magic solution. And then Sarah, same thing, weight and muscle loss in the winter months. She's in Maine. Her horses live outside 24/7 with shelter. They're blanketed. They have free choice hay. They get grain twice a day and are on extremely light work because there's no indoor.
Okay, well, the last thing you said may be the factor in this, right? Because it sounds like these girls are doing awesome with their horses and doing the best they can do. But I understand what it's like to be up north, and like those months of the year, you're probably not riding as you would. So let's just assume that your vets check the horses. There is no obvious physical condition. You've done some blood work. You're up to date on your vaccines and deworming, and the things that have probably changed is less feed, right? Like there's less calories because they're not grazing. Now, if they didn't have, I assume then, so that's probably a factor, is that they're probably not having that grass intake that may be additional. And the big thing is that, like I said, at the end of the day, do you have really weight loss, or is it muscle loss? Is it these horses that are just, all of a sudden are falling apart? And some horses hold their physique and their DNA is great, right? And they just look pretty much the same all the time. And then there's other horses that really bounce up and down. And the work factor can be a real significant issue, right? They're not using their top line. They're not working their core. And so you have to be a little thoughtful as like, how are they losing the weight? And I think that's a good thing to go over with your veterinarian. Again, making sure that you're not missing out on a physical problem. You know, do they need their teeth floated? I'm guessing that you like, let's just assume that all of that's pretty copacetic and you guys are on top of it. Is that, okay, they're losing muscle or weight due to either lack of conditioning, or, I mean, I try to make things black and white, or they're not getting enough calories for your temperature. So you may have to add a few more meals, smaller meals. I think that I wouldn't just do AM and PM and just double the grain. Like that's probably not a good idea. Maybe you can add lunch and, you know, at night check, some additional concentrate if you and your vet feel like, hey, that's the thing. I think hay more consistently, and you might have to change the hay. Like if it's a Timothy hay, or if the hay doesn't have a high nutrient content, you might have to add some alfalfa. Alfalfa is not a bad thing unless, you know, the horse for some reason can't have it. I mean, alfalfa generally is a higher digestible entity, higher protein, and it's going to be more, it's going to have more calories. So I think that those are the things that you would be looking at to say, hey, is the conditioning or lack thereof a factor with these horses? And can we change that? And maybe you can't, or, you know, hey, let's add some calories to this horse's diet. And what kind of calories what are going to be the safe calories? You always start by adding more hay, and then the concentrate, you know, goes with that in smaller quantities. And there's some cool things you can have with feeders, depending on if the horses are in stalls. It sounds like these horses are turned out, but there's some feeders that kind of like they go off at certain times of the day. So you're not worrying about feeding them at 11 o'clock at night because it goes off. And the feed companies, I think, supply some of these. So those are kind of novel if you're trying to put weight on a horse and do it over time, which is great because nobody is an advocate of just dumping, 10 pounds of grain twice a day to a horse that maybe needs 20 pounds of grain, but could have it spaced over 6 meals versus 2, because that's not we can do better management wise most of the time.
That's really interesting. Great feedback. Hopefully, I'm sure that's helpful. Last question in this winter category that I have is interesting. It's kind of this or that. So between two choices, would you rather, 1, naked horses inside with windows closed? It's a fairly airy barn and it stays decently warm this way. Or 2, blanketed horses with windows open. For reference, I'm talking about winter when it's about -10 Celsius, which I looked up beforehand is, I think, 14 Fahrenheit. And the horses have a short coat. They're not clipped, but they don't have a lot of hair.
Definitely 2.
Okay.
Like, I hate barns that are sealed up. I mean, I see them in Florida, and when it's like below 60, people freak out down here and they put the blankets on and the doors are shut, and like, that's bad. Like, we all know this, right? We know that horses need good air quality. They're in a barn, right? With like mold and shit and dust, and depending on the hay and the shavings and the straw, right? So the last thing that, and I argue with clients too, because it makes me crazy, is that, like, I mean, unless it's like a hurricane or that there is a blizzard and it's like 80-mile-an-hour winds and it's -50, right? Like, I get that. The windows should stay open and the airflow should be good, period. Like, it should be, that's a no-brainer to me, because, when horses are in barns and they're all like, it's moist conditions and there's just all of these environmental things that we fight with a lot of these horses. And we all know that there's probably 60 to 70% of horses that have some sort of form of lower airway disease, right? So you're just going to make it worse when they're all inside together and it's hot and steamy and there's no airflow and there's dust and people just shut the barn off for the whole winter. Maybe they open the barn aisle when they're cleaning stalls in the morning. But I am a big advocate of you shouldn't change the airflow unless it was just, like some sort of disaster that was occurring. And yes, that would be fine. But for the most part, I think they can have their blankets on and have good airflow. And if they look happy, like if they're standing there shaking and looking like they're dying, that's one thing. But I don't see too many horses even when I was up north that, like, they're very happy to have the window open and hang their head outside and and have good airflow, and they're not as cold as, like, it's the anthropomorphism of what us people do, right? Like, we're cold. We think that the horse should be like in our house with the heater on. Like, they do not, that is not their gig. They
Right.
we all know they're like a lot happier outside. Put a rug on them if you've clipped them, and let them have fresh air and let them be able to walk around and be happy. I'm just a big advocate for that, unless it's just absolutely extreme. And I think you do your best and you do it the minimal that needs to be done. You're having a blizzard, you keep the horses in during the hard part, and when it's over and sunny, turn them out. Like, they're happy to be out in the snow, and just make sure they have the basics, fresh water supply that's they're able to get to, and hay and their normal feed, and get them moving. And, I think you have to go easy on the exercise. I do think when it's extreme and the horses aren't used to it, I think you can cause some lower airway issues, even with some of these horses that are sensitized to the environment, just in their normal kind of lower airway, low grade disease. I think you have to be thoughtful when the temperatures are really low, and like when you're having trouble breathing, horses, it's going to be a little bit of the same. So you're not going to want to go out there and gallop the horse the day that, God, it's been really nice, and all of a sudden it's -20 and it's hard to breathe, because the horse is going to have the same issue, and their lung components change based on, the insult of the cold weather too. So I think you have to go easy on the exercise when it's extreme. And generally people aren't doing that, right? Like, because nobody wants to ride, but you have to be a bit thoughtful about that. And I'm sure people out west, when you have these dry conditions and it's cold for long periods of time, probably, when the temperatures are below freezing, need to go easier on the horses as far as what they're asking the cardiovascular system and the respiratory system to do.
Yeah. I have some follow-up questions, but instead of entertaining my own curiosity, I'll keep going with some of these we got ahead of time. So, shifting away from the winter topic and honoring the fact that I said that part of this would be Ask Me Anything, Caitlin sent a question in ahead of time about kissing spine and back x-rays, which I'm sure you get a lot of questions about. She said, what are your thoughts on both for PPE? Both are relatively new to the PPE scene in my experience, and kissing spine is much more prevalent than previously known. So how would you advise a potential buyer if kissing spine shows up? I know it varies a lot. And then she said, what are your thoughts on the surgery or rehab for kissing spine?
Okay, those are great questions, and they're like hot button topics that I've already talked to 3 clients today about this.
Oh my gosh.
I talk to people about this every day. So to just back up, so what kissing spine is I don't have a picture handy, but we are generally looking at the thoracic and the lumbar portion of the horse's vertebral column. Okay. So it's the thoracolumbar region, basically from the withers to their hunter's bump. Let's just put it that way. And so there are dorsal spines that stick up from each vertebrae. And we're not looking at the joint or the facet that's down low, the vertebrae itself, because most X-ray systems, you can't quite see where the discs are and the joint. So it's a little different. Can we ultrasound those? Yes, but for the topic of this question, we're basically looking at back X-rays, and we can all do back X-rays out in the field. So they're generally a part of, I would say, every purchase exam I do. Even if the horse has a beautifully formed back and he's got like a crease down it, and it's like a, it just looks like a butterball of a horse. It's like sometimes it's there, like you don't know until you look, right? And it's generally not very expensive. You can usually take what you need in 4 to 5 X-rays. So it's not like it's a 50 X-ray series that you have to sort this out. So it's pretty easy to do. I think thoroughbreds seem to be way overrepresented with kissing spine, and I don't really have answers to those questions. People are looking at the genetics of it, and I certainly have seen very young thoroughbreds that I just take a back shot because I'm X-raying an ankle or something, and they haven't really done much, or they are in their 2-year-old or 3-year-old year, and it's pretty significant. So we tend to see a lot in thoroughbreds. And I don't always think the racing industry does a great job looking at backs like the sport horse industry does. I think they miss the boat on seeing horses that have back pain and having it be performance limiting. But that's another topic. But we do see a lot of it in thoroughbreds. And sometimes the back can look beautiful and they can have it. And sometimes I think, oh, we definitely got to x-ray this horse's back first and there's no impingement. So we're looking at the spines and how close they are, if they override or overlap, or if they have bony change, sclerosis, which is bright white bone, if they have lysis, which is areas where the bone is actually much decreased density. So there's some different grading systems. I think it's 1 through 4. I kind of do mild, moderate, or marked. Sometimes it's one area, maybe T13, T14. So that's not going to be, I guess if you turned it around.
It was one of the odder images I pulled up. Sorry to derail you.
It's not really a good one for there we go. Okay. So so here's the dorsal spines on where you have your cursor. There you go. So like I said, these can be, that's like basically from the withers to the sacrum. And so the dorsal spines are sticking up, can be overlapping or spaced nicely, et cetera, et cetera. And that's what we're looking at. We're not looking down at where the ribs are coming off in that area. You can't generally see that. And so there's different degrees of impingement that we can look at. And like I said, some of the horses I think are going to have it and they don't, and then vice versa. I think it's really important. You have to put the clinical signs of your examination on a purchase exam with the x-ray finding. So I can tell you that I can certainly have horses that have some mild impingement on 2 or 3 or 4 of the dorsal spines. Usually it's more thoracic than lumbar, but it can be both. And it's usually somewhere from T12 or T14 back to, T18, L1. And the degree doesn't always match the x-ray. The degree of the x-ray change or finding doesn't always match the clinical picture of the horse. And so I can take a horse with 2 or 3 impinged areas, and if the horse has a back that has poor muscling, that is painful, that is immobile, I'm going to weigh those kissing spine findings more than if the horse has a beautiful back. There's great epaxial musculature, which is the muscles that run alongside the dorsal aspect of the back, alongside each, like when you run your hand down the midline of the horse's back, those muscles that we can see on ultrasound, their development, their atrophy, they can be helped by certainly some of the electromagnetic treatments to actually improve the muscling on top of good riding, using a equiband system, Pessoas, all those things can help improve that musculature on horses that don't have great core strength. But like I said, unless it's extreme, some of these mild cases, my hands and the history of the horse and watching them move and knowing how they jump or do dressage or whatever their discipline is going to help me decide how much I'm going to make of that x-ray finding, because that's really the key. Because you can have a horse you can have the same x-ray findings and have a horse that it's not clinical. Like they don't know it's in there. They're doing their job great. They know they've had it and they're performing at a high level and they're happy and they haven't had treatments. And then you can have the other horse that has the same findings and, they're painful and they're unhappy in their job, and you can put the saddle on and you can see it on their face, right? Like, I look at those things on top of everything else. And then I weigh that finding a lot more, and that's going to be a problem. If the horse truly has a diagnosis that the kissing spine is causing the back pain or the performance problem, and that can be through nuclear scintigraphy, that can be through joint or local injections. Sometimes we can put some carbocaine and some steroids in that area and then put the saddle back on, the rider back on, and see how that horse does. And if it looks like, hey, yeah, it's really causing the problem, because like an x-ray finding doesn't always mean you need the treatment. Like it has to be clinically relevant to that horse's, good performance or bad performance. So we need to make sure that it's causing the problem before we send the horse for surgery. And that's really
Right.
because you don't just send the horse for surgery. You want to do a surgery and have it be successful and have a good outcome, and that horse, his problem is over with. So there is a surgery. They've done this for many years. They have kind of perfected the technique of going in there and cutting the ligament that allows to free things up. Now, there are some horses that it's really bad, and they actually go in there and they take an instrument and actually carve the bone out so that there's more space. That's not done as frequently, but it can be done if everybody is in agreement and alignment, the surgeon, the referring vet, the client, and the horse, right? Like, it's got to make sense for everybody. So that's an extreme form of the surgery, but there is a lot more of the surgeries. They go in from one side, they clip the ligaments in the areas of impingement, and the horses have a good rehab. I mean, there's a rehab that goes with it. You know, there's a couple of months of using a Pessoa or an Equiband system so that you're trying to get that horse's core and those muscles developed, and using, certainly some of the other physio treatments and chiropractic and all of those things that can be involved in. Again, just doing the surgery is certainly helpful, but you still have to improve that horse's core and try to get those longissimus dorsi muscles to be very much bigger and stronger and more useful. And the only way you do that is if the back works. So they go on some anti-inflammatories, and they have lots of different exercises that can be done, standing and dynamically. And there's a lot that goes into it, but the surgeries can be pretty successful if you have the correct diagnosis, and it's not that difficult a surgery either. I don't do it because I don't do surgery unless it's, the basic laceration or, the bottom, the basic stuff. I mean, we have lots of great surgeons in Ocala, and I've certainly sent horses for surgeries that, it was deemed necessary that this was the diagnosis, and done pretty well for the most part.
That's great. That's super clear guidance for something that can feel very unclear. So those were helpful steps. We are coming very close to the end of the hour here, and right after this, I'm going back and taking notes myself on all of this, and I'll share it probably to our blog or via email. But I can't help myself because there's been so much helpful information in here. As a kind of like fun question to top this conversation off, we have passed Thanksgiving, like you mentioned. We're heading into the next round of holidays. For people who would like to express a little bit of extra thanks to their veterinarians, are there any good gifts for veterinarians? Maybe, kind of in any geography that you think would be appreciated?
I'm going to tell you, honestly, there's not one thing I need, but it is so nice when you get a text message from a client, or they just send you a note or an email, and just a thanks. I mean, honestly, like, that is all like we want. I mean, that's that when somebody really stops and takes time out to appreciate what you do, and all the questions that you've answered, and all the little things that you've done that sometimes, we don't feel appreciated for because everybody's so busy, and I'm probably the same way. Even with the clients, I try to remember to stop and appreciate them. I think it's just taking time to be mindful and just saying thank you. Like, that is, I can tell you that makes my day when somebody, I laugh with my clients. I'm like, you guys always call me when there's problems, which, again, that's what I signed up for the job. But, like, people forget to call you to say, hey, like, my horse won over the weekend, or my horse feels so much better after the treatment, or, like, we really appreciate you calling 8 times yesterday because we didn't know what we were doing with, checking up on a colic or something. Like, that's all I'm sure. If you asked any vet, there's not one thing I need other than winning the Powerball. But second to that is just a thank you for, thanks for taking the time to help, because that's the best thing you can give somebody, is just being mindful of how they help you. And I try to remember that too. That's it. We just need to thank you.
Yeah. That's such great advice. That's the perfect thing to leave people with. And I'm definitely inspired. I'm going to send some thank you notes after this as well, because it does go such a long way.
It does mean a lot. I will tell you, like when I get that little text and I'm having a bad day and somebody's like, thanks so much for taking the time to explain that to, you know, my client, they really appreciated it. Like I'm like, okay, that's why I do this. You know, we get lost in the mix sometimes with stuff that, you know, I'm putting out fires all day long. And so it's nice to somebody to just acknowledge that they, you know, hey, we appreciate that, you know, you're always there for us.
Totally.
And I'm just going to say one last thing about the winter stuff. Don't change things up. I think people make the biggest mistake when they overthink winter. Just try to keep your same regime of what you do and keep the horses fed and watered. And yes, you can put the blankets on. I think that's fine. Keep the windows open if it's not 1,000-mile-an-hour wind, because they're happier. Try to not change things, even though we changed it for us. Like horses like routine, as we all know. And, you know, like I just try not to, don't overthink it. Just keep things the same, especially with the older crowd of horses, and don't do anything. Like, you know, don't deworm your horse the night of the blizzard, because when it colics, your vet will not be happy.
Right. And you won't either. Your horse won't either.
And they're going to say, why did you do this? Why did you deworm this horse? Yet, you know, whatever. Or, you know, just try to keep things the same. Don't change it up. And just make sure they got plenty of hay and water and shelter, and you'll be okay.
Well, you equipped us with the confidence we need to make these decisions during the winter. We also have somebody in the chat. I apologize, for some reason this platform doesn't tell me who it is, but she already said that she contacted her Purina dealer already, and she's meeting with a nutritionist to test the hay this week. She appreciates the suggestion. So This information that you're sharing really does, I mean, it helps people so much. So on the note of appreciation, on the note of appreciation, sorry, what, Lisa?
I said, I'm always happy to share my knowledge, and I enjoy all the questions, and it's nice to just to have nice, easy conversation. I'm so often explaining things that I am frazzled about. So this is nice to talk about like some basic stuff and kind of bring it back to the basics, and to remind people to just, you know, like these horses are horses, and they have survived, you know, hundreds of thousands of years, like without humans, you know, like, so, you know, we try to help them along and do a little bit better, but, you know, try to remember that they have survived without us in the cold and in the heat. And despite, you know, supplements and this and that, you know, for the most part, like, you know, they're going to be okay. Just have confidence and don't change it up. And, you know, just don't overthink it, and ask your vet if you really are in a jam and you're stressing out. We'll be happy to make sure that, I mean, that's the nice thing that I can do for people. Cause I have to remember, like, sometimes, like, I know I have the knowledge and other people need that because that's not their gig. And sometimes 2 seconds of my time, just reassuring somebody that they're okay and they've done the right thing, it means a lot to them. And I'm glad I can do that to help people out.
Totally. It does provide so much comfort. Like, I have found time and time again that things I would have thought were common sense aren't necessarily the correct thing. So to have somebody like you, and like you say, like, not in an emergency situation, just to take time with you to kind of like dig into some of these things so that ahead of time we can, you know, have the information we need to make the choices and make the right choices. So we're not calling the vet maybe quite as often, is really helpful. So this was such a treat. I'm so glad that we got to do it again. And I'm so glad that you were up for it again. I'm not sure.
I'll be up for it again. I'm happy to do it again. I enjoy it.
Well, we appreciate it so much. We have not had experts on multiple times. I'm trying to think of, you know, anyone beyond a coach, and no one's coming to mind in 118 episodes. So you definitely have stood out as someone who really, you know, is providing the information that is very powerful and comforting and all the good things. So thank you so much, Lisa. I hope you have a wonderful evening. I know you're on call right now, so I hope you get to stay in your home and not out on call. But we really appreciate it. And for everybody who tuned in, this episode will be live on the app on Tuesday.
Happy holidays, and thank you for having me, and enjoy the winter. And if it really gets miserable up there in Minnesota and, you know, the Great North, you can always come to Ocala. There's a horse show every weekend in, like, I don't know, 4 or 5 different venues. And it's, there's lots going on here for the next 5 months. So if you just have had enough of it, come down and visit us.
I know people are tempted. Maybe that was the nudge that they need. Something